specifically how to find and evaluate health information. I apologize a little bit. I've had bronchitis a little bit all week, so my voice is a little funny, but I think I should be fine. I've been saving myself for this presentation. So first I would like to make a land acknowledgement. McGill University is on land which has long served as a site of meeting and exchange among Indigenous peoples, including the Haudenosaunee and the Anishinaabe nations. We acknowledge and thank the diverse Indigenous peoples whose presence marks this territory on which peoples of the world now gather. And I actually have my own little acknowledgement, a little statement. So I have a personal commitment that I've made to be an ally to the Indigenous peoples on the land in which I live, which I think is appropriate because we're talking about health today. So I make yearly donations to the Native Women's Shelter of Montreal. And one of the things they do is they combine the traditional healing techniques with contemporary approaches to give the women staying at the shelter all the different options that they would need to address their health needs and issues. So that's the way that I like to show my support and allyship. So first, I have already mentioned this to a couple of people who walked in, a disclaimer, I'm not a health professional, I'm a health information professional. So this presentation is really just for informational purposes, and it should not replace the advice of a health professional. Nor should the resources I'm pointing to you replace the advice of a health professional. You should definitely consult with someone who does have that expertise if you have any health issues. So, hi, who am I? Why am I here? I am actually no longer the liaison for the School of Nursing. I was for many years. I came here in 2017, and that's what I did. I've been the interim head of the Schulich Library for the past year, almost. It will be a year on November 1st. And very, very briefly, I was the liaison for the School of Dentistry. But what I'm about to share with you today, the expertise I have in this topic, comes really from the time that I spent at the Jewish General Hospital for 12 years before that. My first job was working in a family medicine clinic, providing what we called an information prescription service, which is a little innovative service that I collaborated with the clinic to offer. And what that meant was that doctors and nurses could refer their patients to me if they felt that it would be helpful for their patients to have information. And I also worked with the residents in the teaching rooms, and I helped the residents find information to help their patients. So I also managed the Patient and Family Resource Center in the library, and I founded and co-chaired, sometimes chaired, sometimes co-chaired, a hospital-wide patient education network. So that's where the experience that I have in this area comes from, is those years working in a clinical setting and working directly with patients and families and with health professionals who are working with patients and families, helping them find information and evaluate it, most importantly. So today, this is what I'm going to be covering. I'm going to talk about the benefits and the potential harms of being informed. I'm going to help you, give you some pointers about finding health information you can trust in various formats. And then we're going to talk about evaluating what you find in those various formats. And I'll then give you just a little overview of some of the resources that are available here in Montreal. But if you're coming from a field, you may find those resources where you are coming from. So first of all, benefits and harms. We all know that information is power. So definitely there are big benefits. And I'm going to start with those. So of course, being informed helps you participate in your health. So you're not just a passive in that process. It helps you understand the news and what it means for you, right? Especially recently, with the pandemic, I think everybody was really paying very much attention to health information. And a lot of that was coming to us from the news because it was sort of what's happening, what are the rules right now, what's the latest. And of course, you're making decisions about your own health and behaviors based on that. So that's important for you to know those things. It helps you to avoid misinformation and disinformation. I'm going to talk a little bit later about what those two things are. It helps you ask questions, it helps you look for answers, and it helps you think critically about what you're finding. So you don't really want to be an ostrich with their head in the sand when it comes to health information. You do want to have that. You do want to have that power to participate. On the other hand, and that's when you're healthy, right? But when you're sick, of course, there are other benefits. It means that, you have a treating team, you can be part of that team. Instead of being the recipient of what the team is telling you to do, you can collaborate and participate. You can, of course, better understand the instructions you're being given and know what are the side effects that you might expect. What are your options? Sometimes there's more than one choice. And you can be better able to make fully informed decisions. So that's very, very important. On the other hand, there can be some downsides, actually. It's not all positive. Sometimes, when you're nervous about symptoms and you start checking online, you might actually start to think that there's something wrong with you that isn't actually wrong with you. You may go to I think we all know the joke that, everything that's wrong with you is cancer. If you have a headache, it's cancer. If your knee is aching, it's cancer. So it's that kind of thing. It can kind of feed into, I guess, I don't like to use the word hypochondria, but it can sort of feed into worries about your health that are maybe not founded. And maybe if you talk to a doctor, they would reassure you. Also, information is only as useful as it is good, right? So if you have information that's not useful, and that doesn't mean that it's wrong, it might mean that it's just not appropriate for you in your situation. It might be perfectly fine information, but it just doesn't actually apply to you. It's not relevant to you. So that's important. And of course, as I said before, self-diagnosis, sometimes you can be a helpful member of your team. Sometimes you can catch something, or you know yourself best, right? You're the one who lives with you. So for sure, that's something. But it's important to also discuss it with someone who has real expertise and to figure out a plan for how to proceed, or maybe do nothing sometimes. There are things like online support groups, online groups, online forums. This is a really important aspect of what we can find on the internet in terms of information, right? Peers, other people that are going through the same thing that we're going through, can be a really great source of information. They know better about what it's like to live with a disease. There are some benefits to that. It's frequent, it's flexible, right? It's online, often it's not tied to schedules. Sometimes it can be hard to see a doctor regularly, so it can be nice to be able to have a group of people who know what you're going through, who can provide support. It can also be private and anonymous. Maybe you don't want to tell your friends what you're going through, or your family. Maybe you don't want them to know all the details of everything that's happening. So here's a group of people who don't know who you are, and you can talk to them. That can be helpful. And again, the geographic issue is not there anymore, right? Because you can connect with people all over the place, especially for online kinds of groups. There are some risks, though, in getting involved in groups like this. You don't know who's on the other side, right? The downside to private and anonymous is that you don't know who's on the other end. And I guess sometimes, and this is from the Mayo Clinic, so they're drawing from their experiences with these groups. I think they host quite a lot of groups. Sometimes you get inappropriate messaging. People are not so nice, so that can be not great. The more you go down this rabbit hole of being connected to people that you don't know, maybe that's disconnecting you from the people that you do know, the people that are close to you. And again, misinformation and disinformation. And I said I'm going to talk about that later, what is the difference. But basically, you've probably been hearing these words a lot. So we're going to go into the definitions of what those are. But again, are these experts? Not necessarily. Are they basing what they're telling you on actual expertise, actual research? Not necessarily. So that's something to be mindful of. A lot of it is, yes, it's personal experience, but it's also opinions. And opinions can not be correct. And you might get a bit overloaded with all the different opinions and thoughts and messages and this, that, the other. So that's something to keep in mind. And it can also lead to misunderstandings and confusions. So these are just some things to keep in mind. And also, there may be people there for other reasons than because they are suffering from a similar thing as you, because you don't know who they are. They might be trying to convince you to buy something, or try to get information out of you about yourself that they're going to use for other reasons. So these are just some things to keep in mind. Of course, I think Google's probably the #1 place that everyone goes to for health information, right? So we're going to talk a little bit about how does Google actually work? What is Google? And how does it work? And I'm not here to tell you not to use Google, by the way. I'm just here to explain a little bit more about how it works so that you can use it more judiciously and, do your searching in a way that will get you to the better information. So I'm going to play a little video with you that sort of explains a little bit about how the back end of search works. And I don't think this is focused just on Google, by the way.
Hi, my name is John. I lead the search and machine learning teams at Google. Well, I think it's amazingly inspiring that people all over the world turn to search engines to ask trivial questions and incredibly important questions. So it's a huge responsibility to give them the best answers that we can.
Hi, my name is Akshaya, and I work on the Bing search team. There are many times where we'll start looking into artificial intelligence and machine learning, but we have to address how are the users going to use this? Because end of the day, we want to make an impact to society. Let's ask a simple question. How long does it take to travel to Mars? Where did these results come from? And why was this listed before the other one?
Okay, let's dive in and see how the search engine turned your request into a result. The first thing you need to know is that when you do a search, the search engine isn't actually going out to the World Wide Web to run your search in real time. And that's because there's over 1 billion websites on the internet and hundreds more are being created every single minute. So if the search engine had to look through every single site to find the one you wanted, it would just take forever. So to make your search faster, search engines are constantly scanning the web in advance to record the information that might help with your search later. That way, when you search about travel to Mars, the search engine already has what it needs to give you an answer in real time.
Here's how it works. The internet is a web of pages connected to each other by hyperlinks. Search engines are constantly running a program called a spider that crawls through these web pages to collect information about them. Each time it finds a hyperlink, it follows it until it has visited every page it can find on the entire internet. For each page the spider visits, it records any information it might need for a search by adding it to a special database called a search index.
Now, let's go back to that search from earlier and see if we can figure out how the search engine came up with the results. When you ask, how long does it take to travel to Mars, the search engine looks at each of those words in the search index to immediately get a list of all the pages on the internet containing those words. But just looking for these search terms could return millions of pages, so the search engine needs to be able to determine the best matches to show you first. This is where it gets tricky, because the search engine may need to guess what you're looking for.
Each search engine uses its own algorithm to rank the pages based on what it thinks you want. The search engine's ranking algorithm might check if your search term shows up in the page title. It might check if all of the words show up next to each other. or any number of other calculations that help it better determine which pages you'll want to see and which you won't.
Google invented the most famous algorithm for choosing the most relevant results for a search by taking into account how many other web pages link to a given page. The idea is that if lots of websites think that a web page is interesting, then it's probably the one you're looking for. This algorithm is called PageRank, not because it ranks web pages, but because it was named after its inventor, Larry Page, who's one of the founders of Google.
Because a website often makes money when you visit it, spammers are constantly trying to find ways to game the search algorithm so that their pages are listed higher in the results. Search engines regularly update their algorithms to prevent fake or untrustworthy sites from reaching the top. Ultimately, it's up to you to keep an eye out for these pages that are untrustworthy by looking at the web address and making sure it's a reliable source.
Search programs are always evolving to improve the algorithms so that they return better results, faster results than their competitors. Today's search engines even use information that you haven't explicitly provided to help you narrow down your search. So for example, if you did a search for dog parks, many search engines would give you results for all the dog parks nearby, even though you didn't type in your location.
Modern search engines also understand more than just the words on a page, but what they actually mean in order to find the best one that matches what you're looking for. For example, if you search for fast pitcher, it will know you're looking for an athlete. But if you search for large pitcher, it will find you options for your kitchen.
To understand the words better, we use something called machine learning, a type of artificial intelligence. It enables search algorithms to search out not just individual letters or words in the page, but understand the underlying meaning of the words.
The internet is growing exponentially, but if the teams that design search engines do our jobs right, the information you want should always be just a few keystrokes away.
Oops. So basically, that's sort of how the back end works. And what that means is that the job of these search engines is to find you what they think you want to find. And a lot of that is based on what have you been looking for already before? What have you clicked on before? What appear to be your interests? What is your location, for example? That sort of thing, which means that your search and my search are going to bring up different things. It's not a consistent result. It's not the same result if you travel. So I don't know if you've ever done that where you live home and you're on a trip and you're Googling, you'll notice that the results you're getting are quite different than what you used to get at home. So that's just something to keep in mind, because what that does is it creates what we call a filter bubble. And it means that you will be more likely to see more of what you've already seen and what you've already shown yourself to like or be interested in. And that is not necessarily an accurate picture of all the information that's actually out there. So that's something that's very important, because if you are surrounded by people who think, for example, that vaccines are harmful, and that's the kind of thing that you're searching, you're going to start to only see information that supports that. And you'll think that that's all the information there is, when in fact that's not the case. There's a thing called confirmation bias. And what that is the tendency to process information by basically absorbing the information you receive in a way that just supports what you already believe. So that's something that we need to be mindful of and aware of, because it creates a bias. And I'm going to show you a cute little video that sort of illustrates that. That's kind of funny, I thought. But the idea is to try and fight against that inherent. And we're all like this. It's not that anybody who succumbs to confirmation bias is weak or mistaken, and the rest of us are, too good to fall for that. We kind of all fall for that a little bit. But we can be more self-aware and we can be more mindful. And so instead of searching for something to support your opinion or argument, it would be better to construct a search that is as neutral as possible so that it allows the information to come to you that is actually out there in a more balanced way. So for example, if you want to know whether drinking a lot of coffee can, like as a teenager, can stunt your growth. If you type into Google, drinking coffee stunts your growth, right? That's a reasonable thing to want to type in there because you want to find, is there information that supports that? But what that's telling the search engine is that that's what you want to find. You want to find information that tells you that that is the correct answer, right? So it would be better to frame your question as in, drinking caffeine, height. It's very neutral in comparison, and it means that you can equally find information that says, no, it does not. Or maybe it helps you grow taller. Maybe it's the opposite of what you thought. So to remain kind of open to the possibility that what you think or believe is maybe not true, and to try and see if there's information out there that might, in fact, disagree with what you thought. And that's what scientists do as well. This is what we teach health professionals to do as well, because we can also come to that. We all want to find the thing that supports what we believe, right? So it's just a matter of rethinking a little bit what words you use when you're searching. And being open to the idea that what you thought was correct is maybe not correct. We're going to have questions at the end. Oh, and I am not sure if I mentioned, but we're going to, in fact, stop recording when we come to the question period. That's why we're leaving questions to the end, because, we're talking about health. It's kind of a personal thing. This is being streamed live, and I think it's going to be available for posterity as well, so we thought that would probably be a better thing to do that. So we're going to, when I'm done presenting, so if you need to write down your questions or anything like that. I'm sorry, because usually I do like to interrupt and answer questions while I'm talking, but I think it's better for this because of what we're talking about today. So here's just one more little tiny video that sort of illustrates what I've been talking about.
Vaccines cause autism? Well, I have 1 million results to say they don't, and one...
Now, I don't think anyone in the room can hear that. So, can we adjust the sound? Because it's, yeah.
It's quieter than it was.
I know, we tested it before.
Vaccines cause autism? Well, I have 1 million results to say they don't, and 1 result that says they do. I knew it. Just because I have it doesn't mean it's true!
So this is from a really funny little series on YouTube called If Google Was a Guy. And anyway, I just thought that was a really great way of illustrating what I'm talking about here. So how do you avoid bias? I've already talked a little bit about that. I already mentioned that. Avoid asking questions or using terms that imply a certain answer. By the way, most of what I'm telling you today is not just my own personal opinion and experience. I don't know if you've noticed, I'm putting links at the bottom. I'm actually referring you to places where you can find more information related to what I'm talking about. And at the end, there's a bibliography as well. Sometimes it can be helpful to Google the opposite of what you would like to find to see, is there just as much information that tells me the opposite of the thing that I'm looking for? And that might give you a sense of, where there's more information. And also just constantly rephrasing how you're asking a question. So when you type something, right, and usually we look at the first 10 answers maybe, right? you might be tempted to keep looking and keep looking down. It might be better than doing that would be to kind of rethink how you're asking the question. Maybe use slightly different words. Maybe check to see if there's a little bias in how you're asking the question. Try it a bunch of different ways. Try to get as big of a picture as you can about the thing that you're looking for. Because, yeah, that engagement, right? It's kind of, we use the word iterative. It's not just, you ask your question, that's the answer. You're kind of having a conversation, like, okay, well, but if I ask it this way, what's your answer now? Like, what? Let's see. If I ask you the opposite, am I going to get a different answer or not? And if you find, that you're getting consistent answers, then that's maybe a good sign that you've found some good information. Also, of course, I'm going to recommend some really good resources for you, because part of it is also being able to recognize what is a good resource. So ads in Google, they mentioned a little bit about that in the video. At the top, especially in Google, the first few responses are actually paid. So, we tend to think, oh, the most relevant thing or the best thing goes to the top. Well, sometimes it's the thing where they paid to be there. So just be aware of that. And it's not to say that just because it was paid to be there that it's bad or wrong, but just be aware that there's a purpose behind it, right? There's somebody there who wants you to get this information. And so just, keep that in mind. Usually there's like maybe a tiny little thing that says ad or sponsored next to it. It's not always very, very clear. I would say look for that on any page you're looking at in the web. Like when you're in the news, look for that. When you're even on some of the reliable sites, sometimes resources, they need to rely on advertising to pay the bills, and that's okay. But just, be sure that you can see the difference between the actual content of what you're reading and the thing that's being advertised. And sometimes they're not always marked so clearly. So that's also something to keep in mind. Then, when you're reading the thing, I don't know about you, but that's happened to me before when I start to read something or even watch something on YouTube and they're like giving some great advice. I'm like, oh, this is great. And then all of a sudden they're like, and if you buy this thing, it'll solve all your problems. Oh, okay. Now everything else you said to me is a little bit suspect. And I would just want to check a bunch of other resources to see if they agree with that information. And that's something I recommend too. Like, look in more than one place. Like, don't do what that lady did, where it's like one thing that tells me that answer. Maybe check a few more and see, like do they all agree? Are they all kind of saying the same thing? Maybe a few details will be different here and there. It can also be helpful because sometimes one good resource might not mention a particular thing that's useful, and another good resource will mention that thing, and so you've added information. So in the end, why am I telling you not to stop Googling? Why am I saying don't go there? You're going to get sucked into, all this terrible information. It's dangerous. Well, let's face it, right? It's accessible 24/7. Sometimes you wake up in the middle of the night and you're not feeling well, and you want to know, can I take an aspirin? I'm on this other medication. Is it okay for me to take cold medicine right now? And you can't call someone up at 4 a.m. to ask, right? But you can find that information. It's free, it's fast. Well, free, we do pay for our data, right? But you're not paying additionally for that information. It's not like buying a newspaper. And you can get very current and up-to-date info online. So for example, if you buy a book, by the time that book has been published, it's taken probably a year or two for that book to be published, which means that even if that is the latest book on the topic, it's still maybe a year or two out of date. Whereas if you're looking online, the chances are, and you should check, to see when was this article written, when was this blog post posted, you can check the date. It will probably be, it's faster, it updates faster, so it's more current. Like I mentioned before, it gives you the opportunity to check multiple resources. So you're not stuck just looking at one thing. You can go here and there, you can check. And then, of course, I had mentioned earlier community groups, support groups, that sort of thing. That's available there. So that can be really useful. So definitely don't stop Googling or Binging or wherever it is that you're doing your searches. But just do it judiciously and be aware. So here are some sites you can trust. And I say that with always a little bit of a grain of salt too, because again, this is just information that's been put on the internet for you to access. It's not the same as the expertise of a health professional. And also it is generic on purpose. You are not generic, right? You might have multiple things going on. You're a unique and special individual. And so nothing that you find in any of these resources, however current or reliable or based on evidence it may be, it will not be tailored to your specific situation, to your age, to your gender, to your past history, to your other comorbidities, the other health issues that you may have be going on at the same time. None of that is taken into account. There are different types of things you can find. So there's some general interest ones I'm going to tell you about. There's some that are more focused on specific topics. There are tools, there are apps that you can put on your phone, social support sites, and also medical research. So, you might feel comfortable going straight to the source and reading research articles. And so I'm going to show you where you can find that if you're interested. And you probably came across these things already on your own. But I've sort of curated them for you. I've picked a few that I recommend. So general interest, these are, you've probably heard of Mayo Clinic. You may not have heard of the other ones, maybe Health Canada, but you probably, I don't know if you've heard of Medline Plus. Has anyone in this room heard of Medline Plus? Okay, some of you have, some of you haven't. So Medline Plus is what we call a consumer health resource. It's made for the layperson. And it's made by the National Library of Medicine. That's a American organization. They also have created what we call Medline, which is basically the #1 health database. And so this is the one that was made for public use. And what's interesting about it is that when you go there, it's sort of like searching Google. Like you would put in a search to look for your topic, and it brings you only reliable results. So it gets rid of all the stuff, the ads and the misinformation and the disinformation. It does what I'm doing now, which is recommending reliable resources. But it lets you put in whatever question you have. There's a dictionary, a thesaurus. There is health information in different languages. So if you have parents who maybe don't speak English or French, but you want to give them some information, there's stuff you can find in Mandarin, Greek, Italian, whatever it is that you want. It's actually fully available in Spanish because it's an American resource. So that's the one I've highlighted here that I wanted to talk about the most. But these other ones also have a lot of really great information, just generally. Yeah. I did not include WebMD on this list. I have a feeling that anyone who's searched for health information has probably seen WebMD pop up like pretty high up in the list, right? So how come I didn't put it there? Well, remember we were talking about ads and stuff like that? They're very much tied with the pharma industry, and I'm not against the pharma industry. We need what they produce. We need medicines. We need vaccines. So I'm not anti, but it does bring in a bit of bias to the content that they're providing, and the clarity, the difference between what is advertising and what is not advertising is a little bit blurrier. The fact that they pop up so high is also because they've paid to pop up so high. Unfortunately, the good resources tend to just hope that people will realize how great they are, and they don't. And they don't have the money, right, to kind of put themselves up there. But so I generally, like, I'm not saying don't go there, but definitely make sure that you're looking at other resources too, and make sure that those other resources are saying a similar thing. That's what I would say. It's a bit of a conflict of interest going on there, right? So in any case, I just wanted to bring that to your attention because they do tend to, be very much in your face. And every time I search for something in health, the perfect answer is right there, WebMD. But anyway, it's okay. We can resist. Other general interests, so there are things especially for kids' health, for women's health, men's health too. This is a really great one. Something to keep in mind, because I'm mentioning resources that are location specific, right? Like one is American, this one's Canadian. Just keep in mind that wherever you happen to be in the world, there may be different medications that are approved. There may be different names for medications. There may be different treatments that are recommended. So again, whenever you're Googling, just be sure that you're aware, like, okay, this is an American resource. I'm in Canada. I'm not sure, like, can I get this drug? Should I use this drug? Because our approval process is quite different from the US. And the way we test things, the way we measure things can be different for certain things. Like I think in diabetes, there's a different ways of measuring blood sugar and so on and so forth. So it's just something to keep in mind when you're out there. Topic-specific sites include, Canadian Cancer Society. The Heart and Stroke Foundation is great. They have really tasty recipes. I don't know if you've ever tried them, but I really enjoy them. So yeah, if you have a chronic illness, chances are there's going to be a really good website out there. If it's, see if it's associated with an organization, with a foundation, with an association. Make sure that it's coming from a good place, that they're citing their resource. There's, the way I am, where I'm telling you stuff and you can see like, okay, there's actually people out there who agree with me, who've done research that has shown this or whatever. Make sure they're doing that. Then there's some tools. The care calendar is interesting. So it's a way for caregivers and friends to get together to help someone if they have a chronic illness. It's a kind of an online calendar, so people can put in like, okay, I'm gonna walk the dog this day. I'm gonna bring some food by on this day and that sort of thing. Lab Test Online is really cool. That's a place you can go. Let's say your doctor orders a blood test and you're wondering, okay, well, what is it? What is this test? What are they measuring? What are they looking for? Here you can go and understand a little bit better, what is a CBC? What is actually being measured? What is THS or whatever? So you can better understand what we're looking for. It's not going to explain the test results, but it's going to at least explain what are we testing for, which can be useful for you to know. Drugs.com is great. It has an interaction checker. I mentioned that earlier. Whenever you take over-the-counter medications, you might want to just make sure it's okay to take it with other medication that you're on. That goes for food too. Grapefruit, for example, can increase the potency of the dose of certain medications, for example. Like, so, you know, these are things that you might want to check. And then the online health information aid, this is a resource that I actually collaborated on a little bit. It's a research group out of McGill, actually. And there's information when we're looking at how to evaluate information. I'm bringing it from this aid. It's basically a tool that was designed to help people a little bit the way my presentation today is meant to kind of navigate health information in a positive, healthy way. Again, so these are some apps. So you can download apps. They can help you track your asthma symptoms or your pain, or help you quit smoking. These can be really helpful, and some of them are coming from, you know, really good organizations like the National Cancer Institute, for example. Again, be aware. Make sure that they're not collecting health information from you that you maybe don't want to share, that sort of thing. So these, I'm not going to go through one by one because there's too many, but these are some of the ones that I found that were good. The last one is from the American Medical Association. The one about vaccines is from the Children's Hospital of Philadelphia. So these are health professionals that were involved in creating these things. McGill even has a few. So these are ones that are being used for cancer patients that belong in OPAL to help them kind of manage their treatment and keep in touch with their health team. The dialogue one we use at McGill, it's for McGill students to access healthcare through 24/7. And then, of course, I was mentioning support sites and forums. So here are some that are known to be quite good. The Ami Quebec one is great. It's local here. So, you know, it's for people that are suffering from mental health issues or have family members that are suffering from mental health issues. It's a really great support network. And yeah, the Canadian Cancer Society is fantastic. They're great, especially like if, let's say you have something that's rare and there aren't a lot of people locally, because the cancer, there's a lot of support groups, so you tend to be able to find one locally usually. But if it's like a really rare form of cancer, there might not be anybody locally, right? So this is a great way to connect with someone, connect with also survivors, people who've been through it and gotten to the other side. And then for medical research, here are some resources that you can search to find direct access to the research, to the published research. And again, keep in mind, right, that we spend a lot of time teaching doctors how to read these articles and how to evaluate them. So don't take everything that you're reading there at face value. I would definitely not recommend that you make decisions about your health based on one research article that you found. You may think that that research article is worth more than, let's say, a web page on the Canadian Cancer Society website, but in fact, that Canadian Cancer Society web page is based on tried and true many, many years worth of evidence that have been compiled and put there by experts and written in a way that makes sense, that you can understand. This research article that you found may only refer to maybe 3 people. Maybe it was a very small study group. Maybe it's not a very well conducted article. Maybe it's already been debunked by 20 other articles following, right? So just keep that in mind. And we'll talk a little bit more about the different types of articles that you might encounter while you're searching any one of these sites. Just because you're searching through here doesn't guarantee the quality or the veracity of what you're finding, even when it comes to research articles. You always have to be critical. It can feel a little bit daunting and tiring, but the more you do it, the more you get in the habit, the easier it becomes. And it's just a good idea. But that's the world we live in right now. We just have to be aware. That's like one of the number one skills to get through life these days, I guess. Now, I will talk about AI, because of course that's something else, and that's sort of exploded in the past few years. Remember when I said, go for it, Google? I am not saying that when it comes to these things. They are not designed to help you find accurate, reliable information. That's not their purpose. So it's not that they were designed to do that and they're doing it badly. They just were not designed to do that. They haven't been designed to do that. ChatGPT particularly, they are using a data set that goes only so far as 2021. It's a finite set, right? So everything that it's bringing you is based on that finite set. It's not getting new information. As far the last I checked, things are changing very, very quickly. So please keep in mind that everything I'm telling you about how any of this works could no longer be true next week or tomorrow or whatever, because it's really evolving like very, very quickly. By the way, this image I created, I went into Bing Copilot, which is the one that we're allowed to use at McGill, and I asked it, can you please make an image of of an AI robot that looks like an elephant, because it was the elephant in the room. And this is what it came up with. So, and I'm showing you on the bottom what I asked it to do. It was a few prompts. It wasn't just one. I wanted the first one, they were kind of like mean and scary looking, so I wanted to make it friendlier. Then I thought, well, we're asking it questions, so can you give it a question mark? So that's how we created it. So even with there, it's like iterative. It's not like I ask it something and then I just take what it gives. But it makes stuff up. Like, even more than search engines, it wants to give you something. It will never reply, I don't have an answer, right? We've seen many, many cases of it coming up with fake references. Like, so it'll say, oh yeah, this is from this article written by so-and-so, and this is the title of the article, and this is the journal it was in, and the volume, and the issue, and the page number. And then we've got students looking for that article, and that article doesn't exist. So just keep that in mind. You don't know where the information's coming from. It doesn't tell you like, okay, I've created this, I've summarized this information, and I've drawn on these reliable resources. It doesn't do that. It will pretend to be very confident. This is the answer. I have asked questions just to test and see, and it has given me semi-correct information about certain things that looked good enough that if I wasn't an expert, I would not have known the part that was completely wrong. Not like a little bit wrong, but like really, really wrong. Also, we don't know what the biases are here. Whatever they bring you is based on what was put in. So garbage in, garbage out. And are we going to know, this is one of the questions that we're asking, are we going to know the difference between content and advertising? Because it doesn't have the same structure, right, that we're used to. So anyway, at this moment in time, I very strongly do not recommend. People are doing it, though. I have colleagues in healthcare who are saying, librarians who are saying, oh, patients are coming and they're bringing stuff they printed out of ChatGPT. Good for them for bringing the stuff, right? They're bringing the stuff, they're talking to their doctor, they're saying, this is what I found, and the doctor could then explain, well, actually, that's not correct. So I'm not criticizing the people who are doing that. They did the right thing. But you're not going to get good answers. Yeah, so don't do it. Oh, and there's more. Ha ha ha. Yeah. One of the things that it pointed out also, and this research article pointed out that was interesting, is that the level of complexity of the answer is actually going to be too high. And I say this not in a patronizing way at all. Like, I'm a health information professional. This is my job. When I'm sick, I revert to like a grade 6 level of reading. Like, I cannot. I'm stressed, I'm scared, I'm tired, I'm not feeling well. I don't have the capacity anymore to process complex information. And all those consumer resources that I shared with you before are designed on purpose to be clear, concise, well-written, easy to understand, for a reason. Not because they're talking down to you, but because they know that when you're not feeling well, or when it's about your own health and you're stressed, like, you may be a physicist, but that doesn't mean you need something at that level of complexity. So that's one of the things that these generative AI resources don't really adjust their language. They don't really know necessarily who they're talking to or what's appropriate. So keep that in mind too. Okay, what about books, right? I'm talking a lot about online stuff, but that doesn't mean that you can't get really good information in books. Sometimes it's not as much the currency of the information, it's more the depth. Maybe you want something that goes into more depth, that you can curl up on your couch and kind of really dig into and maybe understand the history and the evolution of something, or read personal memoirs and accounts, there's many different reasons why reading a book can be really, really helpful and useful, rather than just being at your computer typing stuff in, right? So I definitely still recommend books. We happen to have a fantastic collection here at McGill, so I am now advertising. I'm telling you about our books downstairs. For those of you who are in town and who are members of the library, well, actually, you don't have to be a member of the library to come and browse this collection. You can just come anytime. You do need a membership to borrow them. And this is called the Wendy Patrick Collection. And you can search our catalog, and I'm getting into the nitty-gritty here of how to search the catalog to restrict your search to only these books. And basically, you put the letter B and the number 8 and a colon, and then in the search, and then you type in whatever topic you're looking for. And that tells it, search for that topic in the Wendy Patrick collection. So if I typed in gluten. You have to write Wendy Patrick collection, sorry, with the quotes after the B and the 8. And if you type in gluten, for example, it will bring you books that talk about gluten from that collection. So now you may find that, and I'm going to talk about it later, there are libraries and hospitals, patient and family resource centers. They have books available to you. So McGill's not the only place where you can find that kind of book. And we do pay very attention to what we're putting in that collection. We don't just buy the latest thing that was published. We make sure that it's good information. So very important is how to evaluate what you can find. But I'm seeing now, I'm not sure I have time to play this video, but maybe I will anyway. This is kind of cool. This is a McGill little video. Okay, are you gonna let me go on? There we go. Okay, so I'm gonna focus now on just how to evaluate what you're finding. And this can be applied to any type of information, online, books, whatever it is. These are the 5 things to keep in mind. Who's providing the information? Why is it being made? What is it? When was it published? Where is it coming from? So we'll go one by one, but so this is, you want to know, I told you who I am, right? So I'm talking to you and I've explained to you where do I get my expertise. You want whatever information you're getting to also have that courtesy to tell you where is it coming from, who's created it. And obviously you want to focus on resources that are coming from trustworthy organizations, ideally. That doesn't mean exclusively, right? But ideally. And this is not just the only criteria, but especially if you can't tell who created it, be a little bit skeptical. Again, I keep mentioning, make sure that it's based on scientific resources. Usually when there's a lot of hyperbole, you should be aware a little bit. If usually when they're trying to tell you, no, don't trust your doctor, that's maybe something to be skeptical of it. Because why couldn't you trust your doctor and also appreciate this information? Why does it create that sort of negative relationship? Where is it coming from? I've mentioned this already before. Is it citing the sources? And I'm going a little quickly now because I want to get to the end. I've already talked about these things while I was talking to you earlier, so I don't want to be repetitive, but when it's time to watch the video, you can look at it a little bit more closely. And this is where, ads come in. Are they trying to sell something? Why was this information created? Who's funding it? Follow the money kind of thing. Are they trying to get you to do a specific thing rather than just inform you? Definitely don't share personal information. And again, we want to be sure that the information is still relevant to us today. That was really important during the pandemic because the information we were getting, that was kind of sped up the whole thing. The information we were getting at the beginning versus what we were getting towards the end may not be the same thing, right? But that information from the beginning is still out there. You can still find it, but it's no longer correct. It's no longer current. So here are some fact-checking resources. When people are sharing stuff with you on social media and you want to just check, is that for real? Because sometimes things can seem a little weird. Sometimes weird things are true, right? But sometimes they're really not true. So these are some places where you can go and just check, is this a hoax? Is this for real? Here are a couple of places you can go to get tips on keeping your health information private and secure. Evaluating the news. Okay, so that's one I want to spend a little bit more time on. It's a personal pet peeve of mine because we get a lot of health information from the news. I don't know if you've noticed, but they're not very good at citing their sources. I've had doctors come to me going, I want to read this study that they're talking about in this article, and it's taken me 2 hours to figure out what was this article, where was it, what journal was it published in, what issue was it published in. It's very frustrating. A good reporting should include a link so you can see what actual research study they are talking about so that you can go and look for yourself and read for yourself and check whether what they're reporting in the news article actually matches what the researchers were trying to say. Yeah. So a lot of news outlets fail this study. Sometimes, they'll say, oh, the new study shows that caffeine reduces your likelihood of getting diabetes, and then it turns out that that study was done on rats. It seems like we're making a big leap here, reporting something that is kind of clickbait. They want, the reason they write these articles is because they know you're interested and they want you to click because they're going to make money off of that. So they can exaggerate things sometimes. They can make connections. They can say one thing causes another when actually it doesn't. Maybe they just both exist simultaneously. Maybe it's a correlation kind of relationship, right? So that's why you want to actually go and see the original study that they're talking about, if you can. One thing that you should know about is that there are different versions of articles that exist in the world. So these are 3 different versions of the same article. The one called preprint, that's the version of the article that the researchers feel is their final draft. So they're like, oh, we're ready to send this to a journal, we're going to publish it. But it has not gone through any kind of evaluation yet. When you send an article to a journal, they have a process which we call peer review, where you get peers, people who have expertise in that topic, to read the article and evaluate it and see, is it good enough to publish? Are there problems with it? Oftentimes they'll write back their comments to the authors, and the authors will have to address those comments, make improvements, clarify, bring in new research, whatever it is. So the preprint is not, in fact, anywhere close to the final version of what is going to get published, and it may, in fact, represent an article that is rejected and never published. I don't know if you noticed, but during the pandemic, a lot of news reporting was based on preprints. I don't know if that the term rings a bell, but I was noticing that a lot when I was reading the news. They were because things were happening so fast. Preprints became kind of elevated in a way because we didn't really have time to go through this whole process, and that's fine. Like it was necessary, right? We needed to go really quickly. But if you don't know what a preprint is, you might mistake that for established, when in fact, it's kind of still a work in progress. So just keep that in mind. If that's ever mentioned in a news story, it doesn't mean that it's wrong or bad or anything, but it means that's not it's like the cake before it got baked. It's still the cake, it's still all the right ingredients, but it's not quite fully cooked yet. The postprint is the accepted version. So this is the version after all of that happened, the peer review happened, the authors made whatever changes, now the journal editors are satisfied, but they haven't put it through all the, they haven't made it pretty yet, let's put it that way. It's not yet available in their journal, on their website, in their print version of the journal. So it has, at that point, gone through all that editorial quality control, but it's just not pretty. So that's accepted, and then the published version is the one that you will generally see after it's been published. So it's knowing that there are these different versions of articles can be really helpful. Before joining a support group, here are some questions. According to the Mayo Clinic, this is what they suggest, because sometimes these groups are not necessarily facilitated by someone with expertise. You probably do want someone in the room, the virtual room or whatever, that does have that expertise. And if there isn't someone that you kind of know, then it's a little bit the Wild West, and keep that in mind. Are there any confidentiality guidelines? Like whatever you're sharing here, has anybody promised that they're not going to share it? Or is it just once it's out there, it's out there? And then it depends on what you're comfortable with, right? But just be aware, just keep these things in mind. And a few red flags, just like with the video. Anyone who's promising you a miracle cure, generally, there are no miracle cures. And you probably shouldn't have to pay to join these things or buy anything to join these things. If you do, then maybe it's not really a support group. And I promised that there would be some resources that I would tell you about. So these are some that are local I'm going to share with you. So the MUHC has a patient and family resource center. They have actually different sites throughout the system. There's some at the Neuro, there's one at the Neuro, it's a fantastic, actually, that's probably one of the best ones. And then at the Glen site, there's different ones depending, like there's one for children, the Family Resource Center, and that was tied to what was the Children's Hospital, and there's a cancer one. At the Jewish General Hospital, there's a Patient and Family Resource Center as well, and that's where I used to work. So yeah, now we have time for questions. So for those of you who are online, thank you very much for joining. I'm glad that you were here today. And I think that, you know, I made a point, there is a bibliography at the end. So if you want to do any further reading, if you want to check up on me and make sure that what I said is actually supported in what I was sharing, you can come and look at this last page and go and find these resources. But I also did that throughout the presentation. There should be a link at the bottom, so you could pause it on that page and type in that URL, and it will bring you to the place where I brought that information from. And that goes for all the different resources that I shared with you. Lists, if you want to actually go to any one of those, it's not pretty. Doesn't make your presentation very pretty, but it does mean that you can see the URL, which means that you can type it in and go there from the video. So yeah, thanks. I think my voice just changed, so that means we're not filming anymore, potentially.